Thermology is a very unique company. We're currently the only company in the UK and Ireland to provide this type of medical grade screening service. Our systems are registered with your X-ray, ultrasound, MRI, scintigraphy as Class 1 medical grade devices. So our service has become unique primarily because of our veterinary surgeons that are trained to read the technology. Our thermographers are here to collect the data, just like your radiographer and your radiologist. Okay, so we collect the data and it gets sent to our team of vets to read and interpret the findings for your vet.
It's Anthony Condon, I'm a show jumper. I use the service because I find it fascinating. It helps me keep on top of my horse's performance, helps me track any old injuries or new injuries that come along, and I think it's great to keep on top of things. I definitely recommend Thermology. Again, it's great for keeping on top of your horse's performance.
The test is primarily used for equines in non-specific and difficult to diagnose lameness cases. Most vets that we work with find reviewing the body as a whole, then going into localised dysfunction is very, very helpful. We use the test a lot to help evaluate things like Kisser spine syndrome, sacroiliac pain, and it's also very helpful when reviewing joint injuries, tendon and ligament damage on a preventative, during rehabilitation and sort of post-operative really. Many applications to use it, and it's ensuring we select the right cases to make sure the test is effective.
Having had a background of a professional racehorse trainer for some 20 years, it became clear to me that there was a definite need for this in sort of not only sort of multi-limb lamenesses and problems with racehorses, but also drops in performance and things that aren't so difficult to put your finger on. So when I investigated this further, looked into the technique that Sync Equine, Sync Thermology now offer, it was a great help to train. It's a great help to me towards the back end of my training career, and I felt that this could be now used further afield to more effect.
We have different types of scans available, so there's full body, half body scans, region of interest. It really depends what the horse needs and the clinical signs it's displaying on the day of testing.
Thermography is not a standalone diagnostic. You have to use it as part of the tools in the box, as it were. It's an additional to what every practice has, and that you need to use a veterinary professional interpretation service, and on the end of it, it's not accurate enough to read it by eye alone, and you need to have a professional doing the interpretation.
Having a trained veterinary surgeon to read the images at the end and interpret the results is absolutely paramount. Of course, changes can be absolutely normal, and also we need to integrate the changes that are seen on the thermography scans with possible pathologies in the horse, and also to try and relate that to previous examination history in the horse, and also to provide some kind of a guide as to where to investigate in the future.
We have a team of veterinary surgeons that are trained to read this type of technology, so our thermographers will not provide you with any interpretation on the day of testing. All results are sent to our team of vets, and they provide a full analysis with a full body report, normally about 24 to 48 hours after your scan results. So very similar to like of your MRI, you'd send it to a specialist to get read, just the same with this technology.
I decided to use Thermology because I had an intermittent lameness issue with my horse, and diagnosing the problem was becoming long-term much more expensive for me, trying to find different methods of trying to source the issue, and Sync Thermology have offered me a service that means it's a much faster way of diagnosing it. So basically it saved my horse being uncomfortable and in pain, it saved me a lot of money, and she's back out working and I'm enjoying her as I was before, so it worked out well.